when I entered the field, I've had the opportunity of witnessing that exponential rise in youth presenting with gender-related distress. And I was trained in the approach that they call gender affirming care, which really isn't a model of psychotherapy at all. It's
Mm.
sort of antithetical to therapy because it's about not asking questions and not trying to understand the root cause of the distress, but instead sort of slapping this band-aid and saying you must agree with your patient, anything else is bigotry, and then you must usher them along this medical pathway. So when I was first trained in this model, I assumed that although it felt counterintuitive, these trainers must know something that I didn't know. So I sort of, took it with an open mind. But I found that every time that I approached a situation that way in my clinical practice, I never really felt like we were addressing the root cause of the problem. And it seemed like there were these other issues being overshadowed. But I'd never heard of detransitioners. I'd never heard of transition regret. So again, I continued to assume they must know something I don't know, until I started to learn about detransitioners in 2020. And that really changed everything because it showed me the other side of the story. And I started to learn that these people had been harmed, including by therapists like myself. Fortunately, I never did that next level of training where I actually endorsed medicalization and wrote letters to encourage it. I never did that. But when I started realizing what this approach to therapy was doing to people years down the line when they faced regret and harm, it sort of validated that quiet part of my intuition that said there's something off about this. And so I started doing my research, talking to detransitioners, and as soon as I put myself out there on Twitter and blogging and podcasting, parents from around the world started reaching out to me, desperate for help. So I've learned a lot through talking to parents, and now they make up a significant portion of my clinical practice.